Tonight, state lawmakers are considering expanding mental health training for officers. It comes as law enforcement has been under national scrutiny for their approach with the mentally ill. Quentis Jones is here now with details.
That's right. The whole idea behind this bill is for officers to change their approach when responding to people who need mental health care. One lawmaker calling the bill, quote, life-changing. If passed, law enforcement agencies would have to offer first aid and mental health training to officers. This is for both city and county officials. Agencies would also be required to have one officer with training in crisis intervention to help deal with people who are mentally ill. And it doesn't stop there. The bill says if there is someone who needs mental health services in court, the state would have to provide a court liaison or professionals to help in that area. Meanwhile, just last year, Forest County authorities were under investigation after a man was killed when deputies went to a home to serve a civil commitment. That's a legal process of placing someone in a mental institution. It's important to note an investigation by the Attorney General's office showed no wrongdoing on behalf of the deputies. However, Sheriff Charlie Sims says there were a lot of lessons learned, including the need for training to respond to mental health calls. Here's what he said at that press conference.
Not only will our sworn deputies obtain this training, there's also training for dispatchers who take those initial calls to help kind of evaluate the situation. And we're also getting this training for our corrections officers.
Now, also during that press conference, Sheriff Sims told me the majority of his deputies were trained in crisis intervention. Quentis Jones, Twin States News.